First tonight, emergency rule. The new limits on transgender health care for Missouri youth as the House votes to ban access. Good evening, I'm Ann Allred. Mike Bush has the night off. Just hours ago, the Missouri House passed the Save Adolescents from Experimentation Act. If signed into law, it would make it illegal for doctors to provide gender transition health care to kids under the age of 18. Our Laura Barczewski joins us now with arguments from both sides of the issue. Laura?
And the bill sponsor says he believes this measure will truly protect children. But the parents I spoke with who have transgender children say that's the farthest thing from the truth.
Representative Brad Hudson says the Missouri SAFE Act would make it illegal for healthcare providers to perform gender transition surgeries and even prescribe hormone treatments and puberty blockers to kids under the age of 18.
I do want to make sure that doctors that would prescribe life-altering drugs or that would subject children to life-altering surgeries for gender transition purposes, kids under the age of 18, we want to make sure and send a clear message not to do that.
Hudson called the transition methods experimental and wrong.
These particular, especially some of these particular drugs, people do not know of the long-term effects of these on children, even people within the medical community.
Danielle Meert, a mother of a transgender child, says transgender healthcare practices have been studied for decades and are essential for the well-being of transgender people.
The fact that these legislators are demonizing these wonderful pediatricians that have helped countless children. There's no words for the amount of evil.
Transparent President Susan Halla says her child started transitioning at the age of 15.
He was able to do all of his transitioning by the age of 18, and he then had his top surgery, and he was able to then move on to college as his true, authentic self, and he couldn't be happier with how he is. And as a parent, I couldn't be happier.
Paula says she didn't know where her child would be without access to gender-affirming care.
I don't know if he would still be here. I think the legislature always hates it when we bring up the suicide rates, but it's a fact, and it is not a contagion.
The bill now heads to the Senate, which already passed a bill that would exempt care for minors who already started treatment. That bill would expire in 4 years, unlike the House bill, which would remain in effect indefinitely.
Right around the same time, Missouri Attorney General officially issued an emergency order that goes into effect on April 27th. It will require minors to undergo 18 months of therapy before receiving gender-affirming health care. Doctors must also provide a lengthy list of potential negative side effects and warnings against those treatments. It expires next February.